patients, I tell patients during the preoperative consent process that it's about an average of 7 days in the hospital. Now, again, this can vary greatly. One of the major side effects of Hipec is the intestines from the heat of the chemotherapy get stunned, and they get what's called an ileus. An ileus just means the bowels go to sleep and stop functioning. That ileus can last anywhere from 1 to 2 days to 3 or 4 days. And that's what really determines how long you're in the hospital for. If your bowels wake up quickly, then you can be out of the hospital in a shorter period of time. If your ileus lasts longer, then obviously you may be in for a longer period of time. But I'd say on average, it's about a week. Again, it somewhat varies. So for instance, for a patient, as we've been talking about, who we do a laparoscopic, minimally invasive Hipec, they may be back on their feet in a few weeks. They have minimal small incisions, and if we haven't done a lot of debulking, then they can be quite active soon. If it's a large abdominal laparotomy, which means completely opening the abdomen, and we do a fair amount of debulking, I usually tell patients it's really about 2 months before you really start to feel back to yourself. I tell most patients to take about 8 weeks off of work, but more than likely they'll be able to go back sooner. I'd much rather patients have a little bit more time off and be able to go back sooner than underestimate the amount of time and then get in a difficult situation where they're forced to go back. But I certainly have plenty of patients who after about 4 weeks are ready to go back to work and do just fine.